Imagine this. It's the middle of the night and you're awakened by the phone ringing. It's the hospital telling that your loved one's been in a car wreck. Once you get to the hospital, they tell you your loved one will not survive without a blood transfusion. Do they have the type of blood your loved one needs? Have you ever thought about the importance of giving blood before? Hi, my name is Rachel, and today I'm going to talk to you about the importance of donating blood. To understand the importance of donating blood, we're going to look at the different types of blood donations, the benefits of blood transfusions, and some statistics surrounding blood transfusions. So there are 4 types of blood transfusions. The first one is whole blood donations. This normally takes 30 to 45 minutes and includes a short physical. With the physical, they just check your blood pressure, your iron levels, and you'll fill out a questionnaire to determine if you're even eligible to donate blood. This blood can be separated into 4 components: plasma, packed cells, platelets, and cryoprecipitates. The second type of blood donation is autologous blood donations. This is the safest type of blood donation. If you know that you're going to have an elective surgery, you can donate blood. That way it can be used for you if you need it, which is why it's the safest type of blood donation. The third type of blood donation is directed donations. This is where you can choose who you want your blood to go to. This is normally used for premature infants, elective surgeries, and some other procedures. These donations need to be made no more than 21 days prior and no less than 72 hours prior. In order to give a directed donation, there's certain information that you need to know about the patient. You need to know the patient's name, the patient's date of birth, the proposed usage of the donation, the patient's physician, what hospital the patient's at, and the patient's social security number. So the last type of blood donation is apheresis donations. This is where an apheresis machine separates the blood into certain components. So if you're going in to donate platelets, the machine will separate the platelets out of the blood, and then whatever components are not used will be returned to the donor. So we've talked about the different types of blood donations. Now we're going to discuss some benefits of blood transfusions. Obviously, the number one benefit is it saves lives. It keeps the heart pumping, and it saves the patient's life. So platelets can be used, they're used to clot the blood. These are normally used for cancer patients, transplant patients, trauma patients, any patients that need a blood clotting mechanism. That's what platelets are used for. And then the transfusions can also be used to clean the blood of serious blood infections. This is normally used only as the last resort if all other methods have failed. Those are the benefits of blood transfusions. So next, we're going to talk about certain statistics surrounding blood transfusions. Did you know that 4.5 million Americans will need a blood transfusion every year? That's 4.5 million. And someone needs blood every 2 seconds in the world. So, now 1 pint of blood can save up to 3 lives. That's 1 pint of blood, and there's 43,000 pints of blood donated that are used every day within the U.S. and Canada. That's 43,000 pints of blood, and 1 pint can be used to save 3 patients' lives. So now that you understand the importance of donating blood, let's go over what I've talked about. I've talked about the different types of blood donations, I've talked about the benefits of blood transfusions, and I went over some statistics for donating blood.